Well, I don't know about you, but it feels like sometimes when you hear information, you feel like your mind is blown. Well, this one was more like your heart is blown, right?
Yeah.
This was an incredible conversation with so much depth of wisdom and heart and story, and really about the journey of appreciating our early childhood trauma, how that shows up in our life, and just the different ways to interface with it and looking at the nervous system as Dr. Aimie shares so brilliantly.
Yeah, and I loved how she weaved in different stories so we can really understand it for ourselves and really pick up that mirror and look at our own nervous system and how it's been operating from day one so that we can start shifting it to really live that life of growth and abundance.
Yeah, and she had a beautiful framework for helping people when they're rooted in their trauma. Maybe they're aware of it, maybe they're not, but really encouraging this state or this space of safety, which may look different for different people. And then after you've developed that, then you move into support and then expansion. And so she talks a little bit about that journey that she walks people on and some of the intricacies that one should look for when sort of unraveling some of the stuff from the past.
Yeah, so get some tea for this one and enjoy it. It is a part one, I believe, out of many that I'm sure we'll get to do with Dr. Aimie. So enjoy.
Enjoy. Hello, everybody. Hi, Dr. Sonia.
Hi.
Hi. We're here with another episode with one of our new favorite friends because she's doing some really cool stuff in the world, and we're so excited to talk to her. And her name is Dr. Aimie. And I'm going to tell you a little bit about her before we get started. But what I do want to say is that, you know, it's really often where we get a chance to really connect with people in different parts of the world that are doing such amazing things. And then in these episodes, we learn more about ourselves as practitioners. We learn more about what other people are doing. But this is really an opportunity to anchor into some stuff that all of us have been feeling in a big way over the last couple of years, and beyond that, because most of us maybe aren't really paying attention to it, and that's trauma. So Dr. Aimie is a double board certified medical physician, boarded in both preventive and addiction medicine, and holds double master's degrees in biochemistry and public health. And she is the leading medical expert on stored trauma in the body and addressing the biology of trauma. We're going to get into all of that because that's super important. So she specializes in trauma, attachment, addictions, and having personal experience in foster parenting, which is also an absolute, challenge and beauty and tragedy, and I imagine in so many different ways. And so you bring such a breadth of experience into this conversation of trauma that we're so excited. There's so much more there, but she's also a functional medicine doc, and she's doing some crazy good things in the world, like putting out summits, and there's a new one coming up, and it's all on trauma and addiction and so much more and beyond, as she says. So Dr. Aimie, thank you so much for being here with us today.
Thank you so much. You make it sound like I've been in school forever. And then I look back, I'm like, I have been in school forever.
Right. Yeah. Speaking of trauma, there you go. Like that's
speaking of trauma.
Go ahead. Sorry.
I was just gonna say, I just loved seeing Amy's response to you introducing her, and just the excitement of, when someone is really passionate about what they teach and they're really living it and experienced it themselves. So they're coming from a place that's really from the heart. Like her face was just glowing for those of you that aren't watching and just listening. And so it's really exciting to have you here, and you're just doing such great work that I think all of us need to put more light onto so that people don't feel alone. And I do think that is the biggest challenge when someone has faced trauma or is facing trauma, and just to have that experience of like, you're not alone, and there are people like you out there that really do understand.
Yeah. So thanks for being here.
Yeah. It can make people feel very alone and very confused. That's the other word that I hear a lot. And not even knowing where to turn, what to do. There's so many different ideas on what you can do. Do you meditate? Do you go see a therapist? Do you do yoga? I don't know what to do. And then there's even those people who are experiencing or have experienced trauma and don't even recognize it as a trauma. And so they're having so many either health symptoms, and health meaning physical health, emotional, mental health, all of that. And they don't seem to even have a reason why. And so even having this conversation around, let's talk about trauma, because we got to redefine it so that we even know when we have experienced it and what that looks like.
Yeah, just really normalizing
it. Exactly. Yes.
So Aimie, you got such incredible experience in all these different areas that you've both lived experience, but also studied and trained, and you're training others to do this work in the world too, which is amazing. Can you bring us all up to speed and just a little bit of your story, because it's so eclectic, it's so diverse. There's so many pieces that brought you into this moment that we're in right now. And so help us put some of those pieces together to understand your story more.
And just for the record, when I do pass on and die, on my tombstone, I want it written that she was a collector of life experiences. Because you are right. Like this is this eclectic variety of life experiences. And I think it's been part of my journey so much that it's shaped and formed, and to the large degree, what I do now and why I do it now. Because it's one thing to go to school and have intellectual knowledge, understand something from a textbook or even research articles, but then to actually live something and have to throw half of that out, not know how the rest of the even fits in. Like that for me is really where I got really practical. And it's like, all right, understand all of this theory, but what does this actually look like? And Miguel was put in my home when he was 4 years old, and he had had a very traumatic early childhood background, and don't need to go into all of his story, but just it had been very unstable and very unsafe and very traumatic with some varying different types of abuse. And so, but I thought that I was getting him at such an age that he would be fine, right? Like he would forget it, because what do we say? Like, oh, kids are resilient, and we don't realize, no, like their bodies are just absorbing all of these life experiences. It hasn't presented in disease yet, because that comes decades later. So no, they're not resilient. They're actually absorbing all of their life experiences, for good and for bad, right? So that also means that there's a lot that we can do in inserting good environmental influences that actually change the epigenetic expression of our DNA. And but having him come into my life, my home, my heart, and realizing I actually have no idea how to really help him, because everything that I think I know how to do is not seeming to work at all. And watching him grow and get worse in his emotional and behavioral issues. And I'm like, we got to turn this around, because I could easily see him in jail, and he was 4. By 5, he was trying to kill me, telling me that he wanted to kill me and trying to kill me. And so I didn't feel like I could put that on the back burner, right? Like, we've got a problem here, Houston, we've got a problem, and I'm committed to figuring this out and finding him the help that he needs. And it took years, because I didn't know what I know now going into that situation. But as you say, like, these are the experiences that really help shape my why, right? And so my why, it's to look into someone's eyes and to actually be able to see their pain. You can't just go on with your life, right? Like, seeing that pain. And I love him for being able to show me that pain, and not just keeping the mask on always, but letting me have glimpses of it at times where behind the anger, behind the behaviors, there was such deep pain. And that's the same pain that I see in other people's eyes, right? Like, I'm thinking of patients or clients or colleagues and friends, and you have those conversations with them when they're in that moment where they do feel safe to let their guard down a bit and let the facade go down behind the smile, and you see the pain through their eyes, but it's inside, and that's what motivates you to, all right, like, there's got to be something better, because otherwise we're still just surviving. We're not actually living and thriving and getting above this. We're really still just treading water, and sometimes not even that. We feel like we're drowning. So we have not had many solutions in medicine. We have not actually had many solutions in mental health either. They've been mostly temporary Band-Aids. And it works for a time. It works for, I feel better for the rest of the day after I go see my therapist. but tomorrow, I'm still struggling with the same things. And years later, I'm still having the same patterns in my relationships. Isn't there something better? Right. And so that was the question that I kept coming back to was, isn't there something better that we can actually address the biology so that it shifts for good? And it's not something that we continually have to exert so much effort in our life to be functioning, let alone thriving.
That was beautiful.
Yeah, you said so many important things in there. And I think the big one or the takeaway that I received from that, and we see that with children too, is they just want to be seen. And even for adults that have had trauma in the past, often they're not validated in what they're experiencing because someone on the outside cannot experience exactly what they have, but we can have that compassion and that empathy because we all are holding our own stories. And if we just sit with the other and recognize the other within us, I think it really just opens up this or unveils the illusion that all of us are living in, like you were speaking to, with the masks that we wear or the roles that we take on. It just gives this opening to that individual to kind of sink into what's happened so they can move through it and not, like you were saying, with like the model that we have in the medical system, it's a lot of it's distraction or it's covering things up instead of really moving through what's happened and connecting those dots, right? So you're connecting dots for people of like how their trauma has really impacted their physiology. And that's what we love to speak to as well, because it really does, it holds the key to everything. So how do you take someone through that process of uncovering that, this story that you're holding on to is really dictating or has been imprinted into your body? And how are we going to uncover that so you start to kind of see that there is a different way?
Mm-hmm. Great question, Dr. Sonia. So where do I start? Well, this is something that has been in the development for years. So this is not something that I have always known how to do. And what I understand now is how important it is to have an essential sequence to what we do. There's a sequence in how this stuff gets stored into our bodies and on a cellular level. And there's a certain sequence that we have to honor for reverse engineering that, if you want to call it that, and taking it out, because I did it in the wrong order. At least I tried to do it in the wrong order. And that did not go well until I figured out, oh, I'm missing this piece, or I'm doing the right things just in the wrong order. And so the first step that I have found is necessary is really stabilizing the nervous system. Mm-hmm. And there's so much to unpack just with that. So I'll just kind of give you a brief overview of what that means when I say we got to stabilize the nervous system. So much of what happens when we experience something, and actually the definition of a trauma is that it overwhelmed our system at that time with the resources that we had, with the energy that we had, with the wisdom, life experiences that we had going into that. All of that plays into, did that overwhelm your system at the time, or was it just a stress? Anything that overwhelms the system, that is a trauma and leads to lasting changes in the biology. And so when we look at how do we even start then to undo this, we have to stabilize the system in such a way that when we start working on it, we are not re-traumatizing and overwhelming the system over and over and over again. And that's often what happens in our current model for trauma work. And I would see this as, I actually started as a general surgery resident. And so completely separate from doing trauma work, right? Actually, no, right? Like, because people are people. And what I found is like this human body stores trauma. And so it does not matter whether you're actually in a medical clinic or if you're out on the street in the mall, right? Like all of us are affected in the same way. And so here I am, and I'm seeing patients who have the diseases and they have these symptoms. And where do you even start? We have to start with addressing the overwhelm, because if we try to go into the story first, it will often cause a flare-up of their physical health symptoms. I'm sure you've seen this in your work, where again, like people feel like, oh, I've got to do this personal development work, right? It comes under a whole lot of names. And so they go into these places, they do some inner child work. Let's do some inner child work this weekend. And then the whole next week, they're in this energy crash, or they've got a flare up of their autoimmune symptoms, or their digestive system is way off. And it's like, wait a second, what just happened? Well, it overwhelmed the system. Like it was not in the right order, and it was not done in such a way honoring how to address this in such a way that is going to be helpful to the system and not just overwhelm it. And so before we even go into the story, before we go into these places that our minds and our bodies have shut off in order to protect us from that, we need to stabilize the system so that it's ready for that. So that when we do open that, it has the capacity to handle that stress now and not just be overwhelmed again and go back into the overwhelm pattern that it initially established. So I start with stabilizing the system, and I use a lot of body type of work. I work a lot directly with the nervous system. There are many things that I can do also to stabilize the physiology. So on the cellular level, stabilizing the nervous system. That is very personalized based on a person's labs and traits. But some general ones are things like zinc and even some of the mitochondrial support. These are things that allow the nervous system to be more resilient on a cellular level, which then means more resilient for being able to handle emotional stress and it not collapse and overwhelm the system again. So where do I start? I start with actually building resilience and increasing the capacity of the nervous system for being able to handle stress, so that then the next step, not the first step, the next step is, all right, and let's go a little bit into this story. Let's go a little bit into this. And now our system has the capacity to look at that and not get re-overwhelmed and back into old patterns in our physical health as well as our emotional health.
That's beautiful. I mean, that's really a holistic approach. I mean, it's looking at all these different pieces that interfere with someone's ability to recover or to heal. I mean, you're looking at the whole person right down to that cellular level, which is beautiful. I'm so curious. I mean, you had such a profound lived experience adopting, and you saw these situations. And as you're speaking, I mean, my heart was just melting hearing you speak to it. And you have a depth to you that you can really sit with someone clearly, because you took us all there to that space without having to go into the story in a really detailed way, which is, it just shows your strength of you as a physician and your ability to really connect with people. And so I'm so grateful that you're taking us all into that experience in a really profound way. Knowing what you know now, like knowing that the step one is really create a safe space, and no doubt you're doing all of that when you said you didn't have all the tools, but clearly you had something where you created a safe space for him. Maybe knowing what you know now, what or maybe some things that you could have done differently, or how would you have approached the situation? Because it's a little different for a 4-year-old versus like an adult. So I'd love to just pick your brain on those thoughts.
Yeah. And I'm happy for you to pick my brain. And I'm sure that I will say things that will surprise you, because it's actually not different. A 4-year-old, a 38-year-old, it does not matter.
I guess you're working on inner childs all over the place. So
right. We've got inner childs running around the whole place.
Yeah, that's what I always say too. We really are just little kids in adult bodies.
Yeah.
And so same methods apply.
Until we do our trauma work. And
Right.
then that connection is made. Right. Not to say that we lose our inner child, but that our adult self is able to take care of our inner child. So that there's not this gap. Nick, I did so many things wrong. Good intentions, good heart. And yet without the knowledge, I did so many things wrong. And I really set him back in what could have been his healing process because of that. And the very first thing that I did wrong was I did not create a safe container for him. I did not know how to do that at the time. I thought I knew how, and I did what I thought was going to create a safe relationship for him. And it actually was not. So what I did, and I mean, here you go. You asked me, so I will share this with you.
Let's dive in.
But it's very contrary to what most people think is trauma informed. And so for many people, this is really going to break the paradigm that they have seen of what is trauma and what trauma needs. So, and maybe I'll start with telling a story, and that will maybe ease into it, and I will feel safer, that there'll be less judgment if I just come out with the final, like, this is the principle. And it's like, let me lead you there with a story.
Sounds good.
Nick, if you were in Chicago, the bad part of Los Angeles, whatever city, right? Whatever city, or maybe we'll put you in, a foreign country and we're going to put you in the bad part of town and in a dark alley at night. But you have to get through there because your friend lives on the other side of town and he's sick and he needs some soup, whatever. But you've got to walk through this dark alley. And you have the option, Nick, of having one person walk through that alley with you. You've got your grandmother who loves you so much. She would die for you, right? Like, and you are with her and you feel her warmth, and she just gives you the best cuddly hugs. Your grandmother, right? Like that's one choice. Or you can have the top policeman in that city. Who would you choose to walk through that dark alley with you?
Well, I'd have to go with the police officer.
You would?
Yeah.
Okay. Why?
I mean, part of me wants to bring my grandma, but
well, of course.
Yeah.
Yeah, that surprised me.
Really?
Yeah, I would have chosen the grandma.
Well, here's
go with it, Nick.
Go with it.
Let me share my thought process.
Yeah,
so
share
I
your
was
thought
imagining bring my grandma, and I was thinking she's so vulnerable.
Yes, exactly.
Why would anybody attack us?
Okay.
Right. And so I would be protecting her. I'd feel her safety. She's vulnerable. I feel like I'm in a safe place. We're in a little bubble and everything's good. And then I was imagining, okay, well, what if a gang came? What's grandma going to do when there's a gang? What am I going to do? Am I putting her in danger? So I'm thinking if I'm putting her in danger, I don't want to take her into a dangerous place.
Exactly.
So that's when I went to police officer. I don't want to put my granny in danger.
Yep. Okay.
Anyways, it's not about me. Let's get back to your story.
Say you are a 4-year-old child now, and you're looking at your parent or your guardian, your caretaker, and you're seeing that they are emotionally vulnerable, that when you express certain emotions, they tend to fall apart and not know what to do. Are you going to continue to show those emotions to them? No, but you're the child. And now all of a sudden you have stepped into feeling like you need to take care of them because they seem to be vulnerable and not able to handle certain things or get stressed easily. Mm-hmm. And so it's almost like the roles have been reversed. Like you're now trying to take care of your grandma because she's the vulnerable one. And what are you going to do when a gang comes? Right? Whereas when you're with a police officer, and even just mentioning that, right? Like I can feel that shift in my body, like my shoulders come down. It's like, oh, I don't need to take care of them. Mm-hmm. They get to take care of me. And that's why I feel safe, because they're bigger than me. They're stronger than me. They're going to be able to they can handle anything. If the shooting starts, I just get to duck my head. Like I don't have to do anything. They've got it. That is what creates a felt sense of safety. It's actually having someone come in and take the leadership, not in an abusive way, but in a powerful way that says, I've got you. I've got myself, I've got you, and I've got kid, I've got whatever you can throw at me. There is nothing that you can do to me or show me that would scare me away and make me lose my own sense of self and groundedness. That is what creates a felt sense of safety. So what I did, not knowing this, because of course, what do I think at that time in my life? oh, what they need is love, right? Like that's how he's going to feel safe, is by knowing that I love him. And how do I get a kid to love me? Well, I get down on their level and I play with them, right? Like you can hear that this is what we've been taught. And so that's exactly what I did. I bought all of these gifts. I had everything ready for him. And as soon as he came into the house, I was down on his level. I was on the floor. I was playing with him. And now understanding the perspective of him and what he's been through in his life, he's making these immediate judgment calls of, does this adult have their stuff together? Are they someone I can trust? Or do I have to not only take care of myself, but also kind of take care of them because they seem to need this, they seem to want that. And so I put him in a position where he could not trust me because he's looking at me like, she's coming down to my level. Oh goodness, here's just another adult that doesn't know what they're doing. Mm-hmm. And so again, right? Like this totally changes our paradigm of how to even work with kids who have been traumatized, because that's what we have been taught. And that's just simply not according to the principles of neuroscience and what our nervous system interprets as safety. And when we're working with anybody, because now we're going to be able to say, all right, it's not just kids, it's also the 38-year-old, the 72-year-old. It doesn't matter who it is. It does not matter who it is, because the nervous system is the nervous system. And it needs to have a felt sense of safety with that person before there can be trust, before there can be any love. That safety, and it's a felt sense of safety in the body. It's not the decision of the mind. It's a felt sense of safety with that person that even opens the door for trust and love. And the felt sense of safety comes with, do they have their stuff together, or do I have to take care of them? And I have to be not only taking care of myself, but also kind of accommodating them for what they seem to need and their vulnerabilities. Mm-hmm. Did that make any sense?
That was brilliant.
Yeah.
So good.
I have some questions around it. So
good.
Is it just because I had a different perspective on like who I would choose? And so do you find it's independent or individualized depending on what the trauma has been? So as soon as you said police officer, I don't have a lot of trust in authority, and especially male authority. And so for me, the grandmother is going to step up because I've always had to be my own warrior. So I know I would step up and lift up a car or do whatever I had to do my kung fu, whatever I needed to protect my grandchild. So I wanted that mother archetype to step into her like power and power me through that alley instead of relying on this other source. So I wonder if like that would shift how, you know, if it's a parent trying to deal with their child, or even if it's a practitioner trying to deal with male or female or different dynamics, like if that would change how you would step up into a role of trying to create that connection and trust.
So kind of like a different definition of safety depending on the individual.
I'm just curious about that, if you see that, or is it usually it's just that leadership is really needed? I guess you're still getting leadership from that grandmother role too, just in a different way.
Yeah. And this would probably be, when I hear you talking, I'm thinking more in terms of, maybe for you, I would have chosen more of like a warrior goddess rather than a policeman, right? I would pick her. Because if I've given you the choice of warrior goddess, you don't know who she is, right? Like she's still a stranger. Warrior goddess versus grandma who knows you and loves you. Yeah. In that moment in time, you're going to still pick the warrior goddess because you can relax in their leadership and their strength, rather than if a gang comes along, I'm sorry, Dr. Sonia, but you and your grandma are not going to make it. Yeah. Right. You're not. Mm-hmm. And your body knows that. Mm-hmm. Yeah. And so it's not that you don't love your grandma, you do. And that doesn't change the fact that it does not have anything to do with not loving your grandma, but it's that moment of when you are needing to do something that is scary, when you're needing to do some emotional work, when you're needing to do anything that is scary, what does the nervous system need? It needs someone stronger, who's experienced, who can take the leadership, not in an abusive way, but in a gentle, powerful, strength leadership way to guide you through that process, that's what allows you to trust them to take you through that process.
Mhm.
Love it.
Yeah,
Why
thank
were
you.
you curious of why I wouldn't bring my grandma?
Oh,
You seem so shocked. Oh, really?
why did you?
That's fascinating.
I think some of her trauma around like
It was-
the policeman.
Yeah,
right?
yeah,
She's so
right.
hung up
Why
on
are
okay,
you
that's-
picking the police officer?
I don't think she heard anything else that I said after I
I
said
didn't.
policeman. She's like,
Oh
no,
my
not
God.
the policeman. What? Why would you
Pick
choose the
grandma, pick
policeman?
grandma.
Don't you know what the policeman would do?
He'll turn on you.
What a beautiful reframe, though. I mean, when we give ourselves the space to actually reflect on these things, you really see, like there's like, just like there's different tools in your tool belt. You're not going to use the hammer when you have to screw in a screw. So I really, really love what you're teaching here, because I think if you come from this perspective or background of like wanting to create the most beautiful, loving space for your kids, like that we aim to do. And it's interesting too, because there's a different dynamic between how Sonia parents and how I do. I'm ready to drop the hammer, when I need to, and I want to stand in my authority and make sure that they recognize that there's a line that you don't cross. And then Sonia definitely has a different style than me. And when you're bringing someone new in at 4 years old, there's so much that's already been programmed into their mind. So yeah, maybe help people appreciate that a little bit more. And then like that's happening for us, big people walking around still, like in these dark, quote unquote alleys that we walk through in life. Let's dive into that part now.
And honestly, Nick, like this is where we get to have this broader conversation around trauma, because we really get to just talk about the nervous system and these patterns that are in the nervous system. And we get to even forget that we're talking about trauma, because it's no longer, that's not the focus. The focus is what has been wired into your nervous system. And especially around parenting, this is an area in which it becomes very obvious what patterns a person has in their nervous system. It just is right on the surface. We don't have to look very far, right? And other times in life, in other situations, we're able to hide it. We're able to accommodate it. We're able to show up in different ways at different times, depending on how we want to be. But when it comes to parenting, whoa, like whatever is our nervous system is what shows up. And so then we get to talk a little bit around attachment styles and how that is a frame of reference for understanding what is wired in our nervous system. And that's what we pass on from parents to our kids, because we pass on our nervous system. So whatever is in our nervous system is what's getting passed on. There's no, well, I'm not gonna pass that on. I'll just pass this piece on.
Just the good stuff.
It's like, you don't have that choice as a parent. Everything about your nervous system is what gets passed on, whether or not it's actually verbally communicated. That is not how it's passed on. It is passed on in not only your dynamics and every interaction or lack of interaction that you have with your child, but even down to how long of an eye contact do you maintain with your child? How high does your eyebrow lift? Or your facial expressions. These are things that we cannot consciously control. And so, and if a person tried to, like, they would go crazy, right? And parents are already blamed for being crazy. So it's more in terms of just understanding the complexity of how our nervous system is passed on to our child, and stressing the importance then of parents being able to do their own work, because that will have such a powerful impact on their kid. That is honestly one of the best things that they could do for their child, is to do their own work and really help their nervous system be at the level and the state that they want to pass on to their child. And these are things that also really show up in any kind of romantic relationship, right? Because talk about needing and expecting a felt sense of safety and trust and love. And how does your nervous system experience that? And how does your nervous system assess that? And one of the sad realities of our life is that for many people who grew up in family dynamics where there maybe was not a lot of communication around nurture and I love you, not the words, but the actual, unexpressed but felt experiences. And if that's what they are used to, they're used to not getting enough. They're used to always feeling the lack of and wanting it and desiring it and not having it. When they go into a romantic relationship, if they were to have it, they actually end up not knowing what to do with that. And it feels so unfamiliar that they don't know what to do with it, and they reject it and go for someone who will give them what they are used to, just because that is familiar. And there's an element of a nervous system feels safer with what is familiar, even if it's not healthy, it's familiar. The nervous system loves predictability. It loves stability. It loves rhythm. It loves familiar. And so even if it's uncomfortable, even if it's awful, even if it's abusive, if it's familiar, it does provide a degree of felt sense of safety for the nervous system, and a person will choose those things that are familiar. I mean, it just is fascinating how deep these, wires that get into our nervous system go, and how they present themselves in absolutely every single area of our life. I know that as a medical physician, right? Like, I'm usually focused on the biology. And yet when I see these things, when my patients are coming in and they're, just talking to me about their life, and I'm hearing stories, and it informs me so much of actually what the patterns are in their nervous system that, sure enough, I see in their labs and I see in their physical health symptoms. And I'm not surprised when they're showing up with these diseases. And they thought they were just telling me about, this, whatever story, and complaining about this and complaining about that. And it's like, no, that like, this is actually it just tells me so much of, again, yes, pain, but how their nervous system is wired and how it's going to present them in their physical health as well.
You must have such a long waiting list to your practice, because your ability to connect to people in what's really going on and be able to put all these pieces together, it's so brilliant. I love how you, like, it's almost like we are wired for certainty, and that's like built into our sense of safety. Mm-hmm. And it's just like this vibratory match where we just, okay, well, that's familiar. So it's interesting you speak to that, because Sonia actually, had this more interesting environment where she grew up, where like there wasn't a lot of outward affection. It was very different than ours. And so the fact that we found each other and she found a way to feel safe with this different version of expression. Mm-hmm. And it's been sort of a challenge sometimes, because I'm used to that. Excuse me. I'm not choking up because I'm getting emotional. I just had a frog in my throat.
It's okay if you are.
Yeah. But it's
I love how that was important for you to clarify that.
Yeah, exactly. Sometimes I just let it out.
I'm calling you out, Nick.
Exactly. I appreciate that. You're listening. I see you. But it's beautiful, because it's allowed us to constantly evolve in our relationship, as opposed to like, well, that's who you are, this is who I am, and so we're just gonna stay. So the question is there room for change in there? So once we appreciate that there's this vibratory match where we feel that sense of safety because it's familiar, not because it's the best outcome, where can we graduate to?
The sky is the limit.
Amazing.
Like how far do you want to go? Right? Because as soon as you say, all right, I want to be able to do that. I want to be able to have my autoimmunity reversed. I want to be able to, have the energy to go out and do my bike rides and do my hikes, or whatever it is for you. Or maybe it's relationships. I want to be in a healthy, stable relationship, whatever that specifically looks like for you. And then you get there and you realize, oh, but there's more. Like there's just so much more. There's another level to health that I just never even knew was possible before. And so, I talk about it being a journey, because as soon as you reach your destination, you realize, oh, that wasn't the end of the journey. Mm-hmm. and so it's a beautiful process of what I call becoming your true best self, mm-hmm. and being in your best health. And you're always in that process of becoming, if you're doing the work. And certainly a person can choose to not do the work. And I respect that. I totally respect that. There is no obligation, and I love you just the same. You can choose what you want for your life. So it does require this ability to lean in and be willing to continue getting curious about our patterns, and whether those are our health patterns and different symptoms we have, or our relationship patterns, or the patterns that we have for ourselves, and some of the thoughts that we have towards ourselves, and the self-criticism and the perfectionism and the people pleasing, or the need for order. Like there's just so much. It's like, well, what would you like to lean into next? Right? Because there's some work that we can do there. and really, just that curiosity is what allows us to do that. But again, the principles of the nervous system are that it is impossible for someone to be curious and stressed or in survival mode at the same time. I talk about there being 3 states of the nervous system. And the curiosity state is when you are in full parasympathetic mode. That is when you can be curious. And if you are in sympathetic mode and stressed, or if you are in the freeze mode or that dorsal vagal response, there is no room for curiosity. And I don't care how much you try, it's just biologically impossible. And so that felt sense of safety has to be a step to even be able to be curious about this other stuff. So I kind of come back to, so the first step in everything is stabilize that system, stabilize the nervous system so that we can get in and stay in parasympathetic more than we've been able to do before in our life. It's not always perfect, doesn't need to be perfect, but it's just that process of becoming more and more like this. And then that allows for curiosity, which allows for continued growth.
So every year we choose a word or a question or a theme that we want to either work on or step more into. And in 2021, I chose curiosity. And big part of that was just because of the trauma that the world was feeling at that time, and all of the unknown we had to lean into and become really intimate with, really, for not only our own family unit, but our communities and for the world itself. And I find when you do step into that space of the unknown, having these tools that you're speaking to and just understanding like how we can really reach into our physiology, our biology, our environment, and all these things, we can utilize so many tools to help support us and get us into an anchor space so that we can step into the unknown and still have this like familiarity over here to kind of step back into, but just kind of dip our toes over here. And then slowly, as we start to do that, we start inviting more of that into our lives, and how like it's just related to everything. It's related to our food choices. It's related to our habits that we have every single day, how we're waking up and how we're going to sleep. And so it's at like that micro level and also at that macro level. And so all of it's connected, like the micro moments and the big T traumas, and all of them really do go down to that space of the nervous system. And if we can get intimate with that, I think we can maybe conquer is not the right word, but we can really move through so much.
Yeah.
There's a word for what you're describing. It's called titration. And this is one of the exercises that I teach in my 21-day journey into your nervous system course. And so titration is a very key principle where you're just going to dip your toe in and then pull back into that felt sense of safety and manageability, right? And then we're going to open it a little bit more. Ooh, that's starting to feel overwhelming. Okay, then we're going to back out, rather than what still is the model for many people of we're just jumping in. It's like, oh my goodness, good luck with that. I'm staying back here, right? Like
I'm over here, yeah.
Because I've done that before, right? Like I've jumped off the cliffs of emotional work and thinking that this is a good thing, right? And doing the intensity. And actually, in one of my interviews with Dr. Peter Levine, we talked about how people can become addicted to emotional releases, and they need to do these big, intense work in order to get that sense of relief and that dopamine hit. And they literally are addicted to emotional releases. And that's not part of the healing journey. That's actually what is partly keeping them stuck. And so when we can, and also what you're talking about is when we do this work and being able to just dip our toe in and then come back to a felt sense of safety, what you're coming back to is yourself. And we're not going to use the policeman because we've already seen how traumatizing that is for you. Dr. Sonia, like, you are becoming your own warrior goddess, so that you are now being able to provide for yourself that felt sense of safety, so that you can go into scary places and know and feel on a body level that you're going to be okay, that you're safe, because I've got my warrior goddess with me, and she's actually myself. Right. Yeah. And not to say that there isn't room for healing in relationships, because of course there is, but even establishing that ability for you to provide that level of safety for yourself allows you to engage in relationship so much better with someone else, when you're not putting that expectation on them to provide that level of safety for you, because they may not be able to do that, right? Like, whatever, they may be triggered in a moment, and then they're off in their own space, and you're like floundering because you're like, no, I needed you to provide me safety. And they're like, I can't, like, I've got my own stuff that just came up. And so it's just this almost inviting trouble in a relationship when we have not been able to create our own inner warrior goddesses, or policemen for Nick, who keep us safe, who give us that felt sense of, I can do scary things, and I'm okay.
Yeah, I just finished a 6-week journey with a group of women for Women Unleashed, and the one thing I got them to do in the beginning was create that archetype. And then that archetype is what we would carry throughout that journey. And I found that was such a profound exercise for all of us as we were stepping into the alley, to have that ally with us. And then slowly I could see the women transforming into that archetype that they had created for themselves. So I think that's a beautiful exercise for everyone that's listening to do too, just to like have that archetype that they know that they can lean into when it's needed.
So what was your archetype?
Well, exactly what she was describing.
It
was like
She-Ra,
a mix of She-Ra and Wonder Woman, and yeah.
As you're speaking, you know, there's this component of time that's really interesting, you know, where it creates sort of the scaffolding. So we slowly start to put pieces together where we understand things. And I think that we run a bit of a risk when we try to dive too deep into the story ahead of maybe a pacing of what our nervous system is ready for. And then we start to make meaning of something without like the scaffolding and this inner work and all that. Can you speak to that a little bit? Because like, even just talking about hierarchy, putting the nervous system in its acutely very specific, very immediate in its ability to meet someone in a moment, right down to the hormonal system, and then the more chronic states. Like, you're speaking to something like that's in the moment, but there's this scaffolding and time and this beauty of patience, I think, that's really important for people to appreciate. Can you add some depth to that?
Yeah, you know, and I recently read this phenomenal book by a Dr. Sonia. I don't know if you know her. And in her book, she
sounds great.
She talks about a study that was done with Bessel van der Kolk, where they looked at brain imaging while people were exposed to their story, basically. And they saw that, wait a second, like, they are still having the same sympathetic response to their story years later. So there's something about just going into the story without having this scaffolding that you're talking about that does re-traumatize us. It puts us back in that event as if we were there in the moment. You should read the book. It's really good.
I'm getting schooled right now. Sonia's heart is like massive right now too. This is amazing.
So what we need to do, exactly what you're talking about, is we need to give people the tools to not have that type of response when we go into this story. And the way that I do that is through somatic work. And so what I do is I have people do somatic work long before we even talk about any story. They come to me and they've got their story, they've got their whatever, right? Like they're ready to dump all of this on me, right? And thinking that that's what's important. It's important for you to know my story. Actually, I can read your whole entire story in your nervous system. And that's what we're going to work with. And so wherever your nervous system is at right now, today, that's what we work with, because that's what's ready to be worked with. We don't need to go digging for stuff. It's right there on the surface, honey. So let's work with this. And what's showing up right now? And this is a lot of the work of kind of connecting with different sensations in our body. There can be lots of knots in the stomach, or there can even be a knife. It feels like there's a knife in my stomach. Okay, let's work with that body sensation. Don't you need to know the story? No, we've got a knife in your stomach right now. Let's work with that. We've got a knot in your stomach. We've got tension in your shoulders. You feel like you've been carrying the weight of the world on your shoulders. Okay, let's work with that sensation. You've got a terrible headache. Let's work with those body sensations. And in that process, Nick, what happens is that they become so attuned with their body that then when we go into, okay, now let's talk about what happened. And as soon as we go there, they're able to titrate and be able to know, okay, that's as much as the story as my body can handle, and not fall off of that emotional cliff. I need to pull myself back. I need to do my somatic exercises again. And there's somatic exercises for safety. There's somatic exercises for support. And then there's somatic exercises for expansion and growth. The nervous system can do all three of those. So it's, what do you need in the moment? And we start obviously with safety. So, and I walk people through this journey in my 21-day program. And so the whole first week are all the somatic exercises for building safety, so that no matter what happens, you have tools that in 2 minutes, you can shift your nervous system back to a felt sense of safety. And yes, at first you're going to need to do these a lot, right? Because you're going to do it and then you're going to lose it. You're like, oh, shoot, I'm stressed again and I'm anxious and I got to do this again. But then the more that you practice this is becoming what is wired in your nervous system. And it's becoming more of just like your baseline state of your nervous system. And then we bring in support. Support is really important. And this really touches into a lot of the neuroaffective touch trainings that I've done, where we're actually being able to apply touch and pressure at specific points in the body that are key to attachment and early development. And did you get that sense of support? Did you get that sense of nurture? Did you get that sense of, I'm holding your hand, we're going to be okay? Or did you not? Did you feel alone? Were you left to cry it out alone? Okay, well, we've got to provide intentional support for your nervous system to now have a different experience. And when we create a different felt experience for the nervous system, that's what allows it to rewire. And so then we can intentionally provide these different experiences for the nervous system around support. And what would it be like? What would it be like to go through your day actually feeling like someone had your back? Like feeling supported, feeling like you were safe, like you were in your bubble of safety. And you could, what would you do with that, right? Like it would just allow you to be that much more creative because someone's got your back. You can actually create those felt experiences for your nervous system through these different somatic exercises that are designed to do that. And then we can go into expansion and growth. It's like, all right, now that we've got safety, now that we've got support, what's left is growth. And we've got the exercises for that. And it's been so fascinating to see when we have tried to jump to these exercises first and be like, okay, let's talk about, growing, especially look for those people who are like business owners and entrepreneurs, and they come in and they just want the growth, right? Like they don't want the other stuff. I don't have time to waste here. I need to just grow. I need to be able to be comfortable up on the stage and being seen. Okay, I'm just telling you, this isn't going to go very well, but if that's what you want, okay. And so we'll do these growth exercises, and then all of a sudden they'll have a panic attack. And it's like, well, exactly, because until you feel safe, you can't grow and be seen. It's not safe to be seen yet. You have to create a felt sense of safety and support. And then it's safe to be in the spotlight. And then it's safe to be seen, because you've created a different experience of your nervous system where now that is safe. And so it's just fascinating, all of the stuff that we can do for the nervous system. We haven't even talked about the biology of the nervous system and the biology of trauma that plays into all of this. But it's so amazing to see how we can actually tap into this neuroplasticity effect of the nervous system to literally recreate the experiences that our nervous system needs to rewire and be able to have a very different life moving forward.
Yeah, I love that. I feel like it just builds that self-trust that you were speaking to in the beginning, because there's such a loss of trust when we move through trauma and those experiences. So it's like building that back and just putting like pieces of your soul back together, or just compiling it so that you do feel that, like in shamanic medicine, that viracocha that we open up to build that level of safety in that bubble, but really bringing it internally so that you're feeling it all the time, even when there's chaos going on around your world. So I love that. Mm-hmm. This is like part 1 of part 10, everybody.
Yeah.
we are
Amy's our new
Dr.
best
Aimie
friend.
on.
Yeah. We want to hang out with Aimie all the time.
Yeah.
Aimie, please tell, because we're getting near the end of the podcast, and there will be more, as Sonia mentioned. Tell us a little bit more about the program, and like, what does that look like? Who can join? Is it for practitioners? Is it for just the public? Please
just
tell us.
Anyone can work with you.
Yeah. So this is a program that I created, and I call it a journey because it's a journey. And it was out of my work with clients and patients, and they're coming to me. And of course, they're coming to me because they have symptoms. They're overweight. They've got brain fog. They've got fatigue. They've got some autoimmunity. So they're coming to me for their health issues, right? I'm a medical physician. And what I'm seeing is that my work with them is limited, and they're just not getting the results as quickly as I know that they could. And there's just so much other stuff that seems to be coming in the way, where they're having a hard time following through on the recommendations that I'm giving. They're getting disorganized. They're getting discouraged. They're going into self-shame because here we are talking about their weight, and then they just went and ate a whole tub of ice cream, and they hate themselves now. And so now they don't even want to see me. So then they don't see me. And then it's 2 months later. It's like, all right, like this approach, this traditional approach is not working. So it was out of those experiences that I'm like, all right, we need to be working on your nervous system to get it ready to do this work before we actually dive deep into the biology. Not that we're not going to start with some things now, but so much of this, like, we're going to be able to work so much faster and better together when your nervous system has been able to do some of this work around creating safety, reestablishing some trust in yourself, reestablishing an inner locus of control rather than putting things on other people. And so I designed this journey to get ready for doing the biology work. And it became this prerequisite to, all right, great. You want to work with me? Awesome. Let's do this journey together. And in the meantime, sometimes we're doing lab tests, and that way we'll have the results ready for when we're ready for that biology piece. But this is actually, this is where we start. This is the first step. And you may not recognize this as biology work, but this is biology work. Like, we are rewiring your nervous system to get it more time in parasympathetic, so that everything that we're doing together, like, you're actually here with me and not checking out and thinking about other things and not even actually hearing what I'm saying so many times. And so that's how it started. That was the beginning of it. And then I went through an experience also where it was a year ago, just over a year ago. And I had a very, very dear friend and mentor of mine. And he, the story was that he eventually ended up in a nursing home in order to rehabilitate and to be able to go back home after having had a stroke and then a fall. Well, in the nursing home, of course, this was when COVID was just coming through everything. And so he got sick with COVID and he was not doing well. And so I made the decision that I did not want him to die alone. And so I brought him into my home and did my best to try to help him recover. Definitely hoping that would be the outcome. But that was not possible. He was too far into the disease process by the time he got to me. And so here we are, and I had two weeks with him, and his mind was still completely intact. His body was just so severely fatigued. And it was this process, talk about a journey, right? This process of getting him ready to die. Mm-hmm. And it was, it was a moment where there was this him passing over and losing consciousness. Not that his heart had stopped yet, but he was losing consciousness. And he reached for my hand as that was happening and held it to his heart. And I'm standing there helping him make this transition and pass over, and very thankful that in that moment, right, like I'm being able to be his safe person and provide that be that policewoman or warrior goddess for him in order for him to feel safe with making that transition. But what struck me and kind of where my mind went through that process, and then after he lost consciousness, was just what a change there had been in me because of the work that I had done. And I never would have been able to go through that journey and that length of a journey, 2 weeks. It's not like the news of someone died, right? And then dealing with that. It's okay, I'm spending the last 2 weeks of your life with you, and we're going to get through this together, and I'm going to be there every minute of you, and I'm not going to guard my heart. I'm not going to pull back, and I'm not also going to let myself lose myself and fall off of that cliff emotionally and into overwhelm. And just realizing that I had been able to do so much work on my nervous system that I was able to give him that gift. I'm like, this is so needed for our time, right? Like people are in so much pain. They're having to deal with so much loss and change. And then add the pandemic to all of that. Like people need these skills to be able to be more present in their own life for themselves, but also for the people they love. I've got to make this into a journey that people can learn how to start this work for themselves. And so that was how the 21-day journey started. So it walks people through this essential sequence of safety. We have to establish safety first. And how do you do that for yourself? Support, right? No matter what our gaps were in our early life, how do we fill in those gaps now and create a different felt experience for our nervous system in such a way that it's going to result in lasting change for our nervous system? We can't stay on the yoga mat all day. We can't stay on the meditation pillow all day. We got to live life. And so how do we do this work? What is the work that needs to be done to have it stick? And this is the sequence. And then being able to move into expansion and growth and the creativity and the aliveness and actually being present. But so many people, I know that you guys see this, right? So many people, and this was me, right? Like so many people, we live disconnected. We live an element of guarding or shutting off some part of us that we don't want to see, or we don't want the world to see, or maybe we were very tender and had a lot of tenderness that was maybe made fun of or ridiculed or hurt. And so we've made a vow to never be tender before. And is that really how we want to live the rest of our life? I made a decision that no, that was not how I wanted to live my life. And I wanted to have an open heart. I wanted to be able to have open hands and not have to try to control my life. And yet, how do we do that and be healthy and be alive and be present? And it comes down to this work with our nervous system and actually rewiring these patterns that helped us at the time. It helped us survive. And now we just no longer need it. And it's actually what's holding us back. So let's do the work. Let's do the work.
Yeah, it's such a beautiful story. And I think the big thing out of that is it's such a gift to yourself, and then becomes a gift to the world. And it's what we leave behind then, right? It's the legacy that you get to leave behind. And that's really one of our last questions for you too. And I feel like you've kind of answered that with your story. And if it was your last day tomorrow, what is the imprint that you would like to leave in this world?
Yeah. I most want to make a difference for people who are hurting and in pain. And there's just so many different expressions of that, right? Like I think of my camps that I used to run for families, and I'm going to be starting those up later again this year. But being able to see that reconnection between a mom and her child, where she hasn't felt that they loved her or haven't appreciated her or whatever it is, but just that repair of relationships. I think that that's really what it is, right? Like, it's not just the rewiring of the nervous system to rewire the nervous system, right? Like, yes, I've got a strong science background and I've, geek out over biochemistry, but like, that's not the point. The point isn't to be like, ooh, the nervous system, let me rewire the nervous system. It's the repair of what's been broken. It's the repair of relationships, the repair of our relationship with ourself that's been broken the most. And when we've had that broken relationship with ourselves, we only have a part of ourselves to share with others in the world. And so we walk around a bit handicapped and only sharing a part of us. And so being able to repair that with ourselves so that we are safe, we do feel safe to share the whole of us with the world.
Thank you.
My goodness. You are just a bright, beautiful light on this planet. And we're so grateful to be able to have this conversation and share your wisdom. I mean, we started the conversation with how a life was brought into your life, a person, this incredible being. And then you talked of this total evolution that you went through and how you practice, how you help people, and that you're able to help transition someone out into the world beyond, whatever that may be, to be continued. So, I mean, this is part one of many to come. Just lastly, where can people find you, follow you? I know you're on Instagram, you've got incredible content on there as well. People are going to want more of you after they hear this episode as well.
Well, thank you. Thank you for all that. And we are new best friends. So we'll be hanging out a lot. They can find me through a variety of ways. So they can find me through the summit. So they can search for Biology of Trauma. That summit is coming out August 8 to 14. Some very powerful speakers come in for that. We're going to go beyond the diagnoses. They can also just look at our website, which is Trauma Healing Accelerated. And they can probably just search for me, which is Dr. Aimie, and I spell my name Aimie. And so through all of those means, I'm sure that they can find me.
It's
Thank
beautiful.
you, Aimie.
Thank you so much.
Thank
More to
you.
come, everybody. Check her stuff out. Check out the summit. There's so much more that this incredible conversation has to offer as you dive in deeper. So thank you so much.